Test.
Test. Will be right. All right. I always look, yeah, the form.
Timer, right? Mayor,
What?
is it 3 minutes?
3 for public commentary and 5. You're early.
Changed over the last 15 years?
Call meeting to order and start with the Pledge of Allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Invocation by word of life.
Let's pray. Good and gracious Heavenly Father, we're so grateful for your presence with us here this evening. We acknowledge our dependence upon you and look to you for wisdom and guidance here tonight. We thank you for this beautiful community that we call home, and we ask your continued blessing upon every individual, both young and old, every family, every business, and the community of Mitchell. We ask that you would grant wisdom to those who serve in areas of leadership and decision-making, and may we all follow your instruction to be quick to listen, slow to speak, and slow to get angry. I ask all of this in the great name of your Son, my Savior, Jesus Christ. Amen.
Thank you. Roll call, please.
McCardle. Dosher. Rice.
Here.
Savers. Smith.
Here.
Chark. Here. Allen. Barrington.
Okay, we have a quorum. Approval of consent agenda items. Items appearing on the consent agenda may be removed by a city council member for discussion at the beginning of the agenda items, formal agenda items. Is there anything you wish to remove?
No, but I would like to comment and point out that one of the items is a grant for the library, and that's a great thing for the library. We're going to try to do increased wireless internet access to our parking lot, as well as improve a couple of the other things, all in response to trying to serve as many patrons as possible during the COVID time, and we've got people wanting wireless internet and other things. The one item in that, and I know it's influenced other people, we have to spend the money by the end of the year. So we meet tomorrow as a library board, and we'll be looking at that right away to get that all ordered and see what we can get in place.
Okay, thank you.
I'll move approval of consent agenda.
Motion by Mr. Rice. Second by Mr. Allen. Further discussion? Anybody in the audience wish to address these? Roll call, please.
Rice. Savers. Smith.
Aye.
Chark. Allen. Barrington.
Aye.
McCardle.
Aye.
Dosher.
Motion carries. Citizens input. If you need to address the mayor and members of the city council on an item that was not on the agenda, excluding personnel items, please come forward to the podium, state your name and your concern. Presentations are limited to 3 minutes. Items will be considered, but no action will be taken. Does anybody wish to address council? Council have any comments? Okay. Entertain a motion for city council recess to the Board of Adjustment.
Second.
Motion by Mr. Barrington, second by Mr. McCardle. Further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Hearing an action for Christy Duba, 113 West Douglas Avenue. Christy Duba, 113 West Douglas Avenue, legally described as the east half of lots 11 and 12, Block 12, and Epps, First Edition, City of Mitchell, Davis County, South Dakota. Last year, the City Planning and Zoning Commission and the Board of Adjustment approved the conditional use permit for an indoor recreational facility with the following conditions: a code review to be completed, and the applicants come back for review within a year.
Just as the mayor had stated, this is up for a renewal for a year because that was one of the conditions. And so the planning commission did review this at their last regular meeting, and we have not received any complaints whatsoever from this area. So their recommendation is to remove the year review and let them proceed.
Is Christie here?
I don't believe see her. Nope, I don't. So.
Move to approve.
Motion by Mr. Allen, second by Mr. Sabers. Further discussion? Anybody in the audience wish to address it? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Hearing an action for Stacy and Levon Murtha, 2700 Menser Court. Stacy and Levon Murtha applied for a height variance of 25 feet versus 17 feet is required for the construction of a detached garage at 2700 Menser Court, legally described as lots 8, block 3, Woodland Heights, First Edition, City of Mitchell, Davis County, South Dakota. Said real property in Woodland Heights is a planned development district.
Again, this plan was presented to the Planning Commission at their last regular meeting and did recommend approval. We did not receive any neighborhood objection. Just as as the mayor just noted, this is in a planned development district, so their height limitation is at 17. Even if it was in the other parts, most of the other parts of the city would be 22, so it would be a variance nonetheless. So there is copies of the drawings and everything else are in there. I see Mr. Murtha is here if you do have questions of him.
Motion to approve.
Second.
Motion by Mr. Smith, second by Mr. Barrington. Further discussion? Anybody in the audience wish to address it? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Hearing an action for Stephen and Roberta McCullough, 103 North Minnesota. Stephen and Roberta McCullough have applied for a backyard variance of 1 foot versus 5 feet. Height and variance of 26 feet versus 22 feet, and oversized variance of 2,630 square feet versus 2,000 square feet, as required for construction of a detached garage located at 103 North Minnesota, legally described as lots 11, 12, and 13, Block 90, Lawlers, Second Edition, City of Mitchell, Davis County, South Dakota. Said real properties R2.
Okay. Again, the Planning Commission did hold a hearing on this request, and they did recommend approval. However, with a couple options, which they had made a suggestion was option one was that there be a firewall installed on the existing garage as well as the new garage that is being constructed along the west side. Or the second option, what they're proposing is that if somehow they acquire 3 feet from the city property, then hence no variance would be required, at least on the west side. They did recommend approval of the height and the oversize, but those were one concern was on the west side variance. So also I was told that Mr. McCullough cannot be here tonight, so if there are questions of him, that he would have no objection if you wanted to postpone it. So I didn't want to try to speak for him. I had heard too that he may be interested too in moving the existing part back 3 feet, but it would look like a little bit of a jog there. But so he could not be here tonight, so I'm just relaying that message. So, but there was the only comments we received are what's in the packet.
Acquiring the property may be a little tricky because
Correct.
you have to be declared as surplus and then put on. To
Right.
try and let him acquire property, yes. Is that right,
But-
Mr. Johnson?
That back 3 feet, you mean?
Right. Yeah, the city owns a lot that's behind him.
But we would have to declare a surplus and then work out how, it might go to somebody else.
Was there, and maybe we need to talk to Mr. McCullough, any objection to the firewall?
Not
between-
to him,
No, not to him. That
Oh,
was just,
okay.
the reason is because there's already a garage there that's R1, so, right. So that's what the reason was, is, what they thought wouldn't make sense is to have it on firewall on one and not on the other.
Not, okay.
You just want some direction.
Those were two options. If he had the 3 feet on the other side, then he wouldn't need that variance. So there's actually 3 variances he's requesting, so.
So understanding, Mr. Mayor, obviously, the approval of this doesn't mean it's necessary to get built until the surplus of land is being acquired
Correct.
from the
Yep.
city.
Yeah.
Possibility with, obviously, somebody else might buy it or whatever it may be, so.
That would be the problem with trying to surplus the land. I
And then
believe.
he'd have to come back and reconfigure probably the size to satisfy the means if he would
Right.
not acquire that piece of property.
Or he could move the new part back 3 feet, but like I said, it wouldn't line up with the 1 foot that's already there, so.
I think the cleanest solution is the firewall, but it's up to
Yeah.
you guys.
These are just ideas that the planning commission had proposed.
No, I'm perfectly fine with the firewall. That's typical build for your our firewall rating, so. Yeah. Put the
Proof.
dock on both sides.
Approve the 1 foot, but what firewall, both the existing and the new.
Correct, yeah.
That
Did you-
motion?
Funny that we've got to put that in there. Should be code. But
Okay.
anyway. Yeah, I have a motion to approve the plan
Okay?
With-
Yep. Motion by Mr.
with the,
Barrington.
yeah, with the conditions of the firewall being installed on both sides.
Okay,
Second.
second by Mr. Rice.
Mr. Mayor, how much land do we own that abuts up against?
The whole lot.
I think it's one lot that is between
Yeah,
him and
if you
the
could
neighbor,
maybe-
correct?
Stephanie could pull the aerial on maybe
Is
on
there
the
a reason
last
we own
part,
it?
last one there.
Well, I'll put it this
Anything
way, I
else
didn't
on
know we
there,
owned
Sal?
it until after the,
We uncover this about every one a year.
Right there.
Yeah, where the X's are, you could see you could see the north one is where you could see the 1 foot. Where the X's are, that building's gonna disappear, and that's where the new garage would line up with that. And so the lot to the west is a city-owned lot. Or actually, it's 2 lots there, I should say. Yeah, those 2, right.
We've always had that, or is it?
I believe we probably did it when he tells us that there originally was a house there, and then the house got torn down, and I'm not sure how long the city's had it.
I think Steve said he mows it too.
Yeah, probably.
He's taking care of it too.
So you can see where the 1 foot would line up with the old garage.
well, it could be surplus, the problem is, you're not guaranteed he's gonna get it.
No?
I have no problem with moving forward with the firewall, but maybe in the next few months, let's look into
Getting rid of it?
possibly getting rid of that particular lot.
Okay, we can certainly do that. Okay, we have a
It may-
motion and a second.
I'm sorry.
Further discussion?
The one thing I may add, and that's something just to kind of ponder, it may be in a floodplain too, so that might be another reason why.
That
I
might
don't know
be
for
why we
sure,
own
but
it.
that's a possibility.
Okay, anybody in the audience wish to address this? Okay, all those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Entertain a motion for the Board of Adjustment to adjourn the City Council reconvene regular session. Motion by Mr. Rice, second by Mr. Barrington.
Mr. Mayor,
Yeah.
if I can interrupt, I did see Dave Stevens was here. He was intending to come during citizen update to talk about the 211 program, so if we could, is that okay if he does this brief?
Yeah, we'll
update?
give you,
Okay.
we'll give you a few minutes. Come on up, Dave.
We went a little fast in the beginning there, Dave. You
I
just
guess
missed
so.
it.
Hey, we don't fiddle around here, Dave. We keep going.
My name is Dave Stevens, and I'm here representing Mitchell United Way. Back in the ending of 2019, there was an attempt to bring 211, the helpline center, and I appreciate the partnership with the city of Mitchell. The city of Mitchell committed $1,000 for the next 3 years for bringing 211 to Davison County. Our partners at the time then were the County Commission, Mitchell United Way, Mitchell Area Charitable Foundation, the Samuel Weller Foundation, Palace City Lions, and the Central Electric Roundup Program. Things changed in our legislature, and instead of funding half of the 211, beginning with the July 1 budget, they are funding the entire amount. So I am here today to return half of your money from 211 funding for this year, and so I am here to present to you $500. 211 was activated of all times on February 11th, 211. I have a distribution if you would like to see it. We attempted to get it on the screen but couldn't. And I have a distribution showing the calls that were made in the four-county area, Sanborn, Aurora, Hanson, and Davison County, showing the number of calls and the distribution of what kind of information people were seeking. So I thank you very much for being a partner in this endeavor. I'm also here to allow you to cancel your next $2,000 payments for the funding of 211, and I thank you for the opportunity to have done that. Mayor, would you like the $500?
Give it to Mrs. Baskey there.
Okay, here.
Don't give it to him. We'll never see it again. Thank you very much. Hey, if you want to go out and come back in and talk again, $500 a time, we'll be happy.
Thank you for your participation, and we'll look forward. We didn't realize, of course, at the time on February 11th that we were going to get hit with a pandemic. We missed last year's flood and the number of calls that came in on 211, but they were activated and willing and able to take those calls. 211 is staffed by 24/7 by certified people who are trained in mental health counseling, suicide crisis hotline, and any data that they have from input from organizations like cities, counties, school boards, anybody who wants to put in data into the database. So if you pick up the phone and call 211, they will ask you what your zip code is and then process your call. So that's the purpose of 211, and I thank you for your partnership.
Thank you very
Right?
much.
Thanks, Stephanie.
Thanks, Dave.
Okay, back to reconvening. We have a motion and a second. Further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Award airport farm ground lease 2021-5 and airport pasture lease 2021-6 for years 2021, 2022, 2023. Mr. Croce.
Mr. Mayor and Council, Kyle Croce, Public Works Director. So this agenda item is for, first, the farmland lease for the airport. Two bids were received, and staff is recommending award of the farmland lease for a three-year total of $442,824.48 to Doug and Nick Hone. One bid was received for the pasture land lease for the airport, a three-year total of $3,333, and staff recommends awarding the pasture lease to Josh Russell.
Danny, we in the ballpark?
I asked Stephanie, what were the price per acre on that for the lease per year?
What's the
In comparison to the previous bid.
So with regard to acreage, I think we're at roughly $168 an acre for the farmland and 56 for pasture, $56.97.
Fair.
Move to approve.
Motion by Mrs. Turks, second by Mr. McCardle.
It's under one agenda item.
All right. Mr. McCardle got it, so we're good. Okay. Further discussion? Anybody in the audience wish to address this? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Consider approval of $10,000 for Friends of Fire Steel from 2020 contingency funds. This is for the fundraising study that Friends of Fire Steel is putting together. If you remember, they came to us in March or April or May, back when COVID first started. We were concerned about budgeting, so we asked them to wait. Their time has come and they have to pay their bills, so they are requesting the $10,000. We have found a way to do that out of contingency. Can you give the explanation for that, Ms. Elwine?
The council has a community contribution line in their annual budget, and so the $10,000 would be moved during our contingency resolution into that line to fund the request.
Where does that leave us contingency-wise then?
Well, depends. I can pull this up, but I'll show you where we're sitting currently. it's just close.
We do have Friends of Fire Steel people here if you want to ask questions of them.
So, currently, and these are just budgeted amounts because we don't know until closer into the end of the year. We have about 240,000 in there left. We have some cash shortfalls, obviously, with coronavirus and everything going on, but our general fund first and second penny is doing really pretty well. So I got to take some of that off that we had earmarked previously. So. 247? Yeah.
Correct.
I have no problem with this. I'm going to make a motion to approve the 10,000.
Okay, a motion by Mr. Allen,
Second.
second by Mrs. Charks. Further discussion? Anybody in the audience wish to address this? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action to approve amendment number 1 to agreement A 2020-10, construction engineering services for Sanborn Street Boulevard, phases 2 and 3, project 2019-22, contract with Bros Engineering. Mr. Croce.
Mr. Mayor and Council, Kyle Croce again, Public Works Director. So this is a change order for Bros Engineering, and it's extending their services. Basically, their construction, engineering, and inspection services caused through the delay of the contractor of not completing certain sections of the project, basically sequence 4 and 6. But those the contractor was assessed the liquidated damages, so the additional cost to Bros for construction observation services covered under that in the amount of $40,560.
So in other words, the contractor is going to be deducted amounts from his contract, and that amount actually goes to pay Bros Engineering for the additional services they're providing.
Basically, it costs us nothing.
Basically, it costs us nothing. Other than time. Correct.
I'll make a motion to approve.
Motion by Mr. McCardle,
Second.
second by Mr. Barrington. Further discussion?
Yeah, so any idea when Sanborn's going to open?
Right. So they have a deadline of substantial completion of 30 October. So they're looking, everything is open from 9th Avenue South, and so they're looking to get the rest of it opened by the end of this month. Yeah, and it looks like most of the concrete is done. There's some additional sidewalk and tie-ins to be done on that, but the majority of the roadway in that section is complete. So we think they'll make that deadline. And then final completion would be 30 days after that.
They're finishing the side streets right now and the sidewalk, correct?
Tie-ins, yes.
Yeah. Okay, anything else? Anybody in the audience wish to address it? Come on up.
I'm Dwight Stadler. I live at 700 West 7th Avenue. Does this mean you're going to get rid of those signs along my boulevard on my property? I got 5 of them there I'd like to see gone soon, please.
They will be gone as soon as the road opens.
All right,
Yes.
thank you.
Anybody else wish to address it? Okay, all those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action to approve agreement A 2020-39, design and construction of landfill cell number 4, contracted with Helms Associates. Again, this is for 2021, but what we're doing is setting it up so it can get going as soon as we turn the calendar to January 1st, 2021. Mr. Croce.
Mr. Mayor, Council, that's exactly right. So this would be a contract to get into an agreement with Helms and Associates starting January 1 for the design of the next cell for the landfill.
Move to approve the agreement with Helms.
Motion by Mr. Rice,
Second.
second by Mr. Allen. Further discussion? Is there anybody in the audience wishes to address this one? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Excuse me. Action to approve agreement A 2020-40, South Dakota Department of Transportation for pavement maintenance at the Mitchell Municipal Airport.
Mr. Mayor and Council, and so this agreement is with DOT, and it is for maintenance repairs for the runway. As you can see on that final page, There is no cost to the city. The costs come out of the federal funding and the state, as well as the 10% for CARES.
Move to approve.
Motion by Mr. Allen, second by Mr. McCardle. Further discussion? Anybody in the audience wish to address this? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action to approve agreement A 2020-41 Fifth Avenue, Ninth Avenue reconstruction project contracted with McLaury Engineering. Again, this is for the 2021 year. However, this will let them get going right after the turn of the calendar. So, Mr. Croce.
Right, Mr. Mayor and Council, so this is for reconstruction of Fifth Avenue and Ninth Avenue, and then we would get started with McLaury doing the design beginning of the year, and this is for 2021 budget.
And fifth and ninth were chosen because of the, I'll say, poor condition
Of the infrastructure.
Of the
Yes, sir.
infrastructure? Okay.
Yeah, it was identified in our previous plans through SPN on the wastewater collection and the water system.
I'll move approval of the agreement with McClory Engineering.
Motion by Mr. Rice. Second by Mr. Barrington. Further discussion? Is there anybody in the audience who wishes to address this? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action to approve agreement A 2020-42 North Foster Lift Station lining improvements with HydroClean. Mr. Croce.
Mr. Mayor and Council, so this is a budgeted item for 2020. We have $125,000 that was budgeted for this year. We've got a contract estimate from HydroClean for $90,400, and this agenda item is for an approval of an agreement with HydroClean.
Have we used that company in the past?
We have used the company in the past. They do a good job on the lining, and the Foster Lift Station has been on our list for a few years now. So we're ready to get this one done. I think the time frame is as soon as possible, obviously, that they can get out here, and then if it needs to be extended into the next year, we would extend it into next year.
I'll make that motion.
Your completion date's not till May anyway.
It would be May, yeah, that's right, that is the completion date.
Okay. Motion by Mr. Smith. Second by Mrs. Charks. Further discussion? Anybody in the audience wish to address it? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Excuse me. Action to approve agreement A 2020-43 Fire Station Number 2 HVAC improvements with Paulson Air with the use of contingency funds. You want me to start this one for you?
Yes, sir.
The fire station out at the airport has humidity issues during the summer because we don't have any building environmental to it, and it creates mold and mildew within the building and within the building and on the equipment. Most notably, the fire department had to go out and do a lot of cleaning of one of the pieces of equipment they had there, right? Correct, Chief Maris?
That is correct. Yep.
Okay. So in looking at it, the big issue is there's no humidity control in the summer, so it's a very damp atmosphere. So what we're doing is putting in an inexpensive rooftop unit that can provide some environmental control for the building during the summer months. We'll also provide minimal heating in the winter months.
And then the contingency amounts that you just reviewed previously included this on that list? It did,
Yes. It was the line item of one or two above where the Friends of Fire Steel was.
Move to approve. Second.
Motion by Mr. Allen, second by Mr. McCardle. Further discussion?
And what are we storing there?
Yes, currently we have a fire engine out there for the north end of the lake.
Yep.
And the other hazmat trailer, and then also what's called our tech rescue, which is an old repurposed ambulance, which is what you saw there, and that has our dive equipment and things like that in it.
Oh, okay.
And the addition of that second station is what helped with the ISO insurance ratings for
Correct,
homeowners.
that,
Right.
yep.
And there are hoses stored out there on the truck, obviously, and those are things that will start to dry rot if we don't do something to take care of them.
We were quite surprised with this late this summer when we went out there and found it. We have taken care of that. Funny how COVID stuff takes care of white mold and things like that. So we sprayed it down and cleaned it out, and we should be good to go. But yeah, definitely in need of something.
Okay, further discussion? Is there anybody in the audience wishes to address that? Okay, all those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action to approve Resolution R 2020-52, Railroad Crossing Flashing Signal on Spruce Street. Mr. Croce?
Mr. Mayor and Council, so these next two items are related. There's a resolution and then approving the agreement with South Dakota DOT, and this is for the project is the new railroad flashing signals on Spruce. And so we have, our percentage is basically 10% of the total cost, which they're estimating at $394,391. So ours would be 10% of that cost. What we're planning on doing is extending the upgrade to the road on the east side of the railroad as well, so that it can continue all the way to the first entrance to MTI. We're hoping to additionally have that roadway taper down to a one-lane section either way, and increase the two-lane left turn on Spruce. So this will help overall for the traffic in that area, we think, going to the school and crossing the tracks. So again, that's we have funds that are estimated at $375. We're taking 10% of the cost of $394,000 for that specific project.
And one other item to go further is this was committed back in 2015 by the city when MTI applied for a grant, and we just are finally getting to that end of the process.
Okay, entertain a motion?
Motion approved.
Motion by Mr. McCardle, second by Mrs. Starks. Okay, further discussion? Is there anybody in the audience wishes to address it? Okay, all those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action to approve Agreement A 2020-31, in agreement with South Dakota Department of Transportation for new railroad flashing signals on Spruce, PP-PS 372005, Davidson County, PCN 06NL, Spruce Street, DOT 382394V.
Move to approve.
Motion by Mr. Rice, second by Mr. Sabers. Further discussion? Anybody in the audience wish to address this part? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action on Resolution R 2020-72, a plat of Track P Wild Oak Golf Club Edition, a subdivision of Arroyo Tracks number 3A and number 4 in the northwest quarter, section 23, Township 103 North, Range 60 West, 5th Prime Meridian, Davidson County, South Dakota. Mr. Parker.
Yes, Mayor and council members, this plat was presented to the Planning Commission at their last regular meeting and did approve it, as well as since this property is out of the city limits, it also requires the county to approve, and my understanding is both the County Planning Commission and the county commissioners have recommended approval. As you can probably see, it's a large piece that is sandwiched between Calhoun Street and Mattie Street and Bridle and there. And so what this is just to plat it so for the purposes of conveyance, so that it can be sold.
Move to approve.
Second.
Motion by Mrs. Stark, second by Mr. Rice. Further discussion? Anybody in the audience wish to address it? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Discussion on masks in city facilities. At our last meeting, it was requested that we place on the agenda a point to discuss masks in city facilities. I will go through and tell you that currently we are making a slight modification to what we do here in the city because we were a little behind with what CDC required. So what we are going to is a definition of close contact as 6 feet or less for 15 minutes. We were anybody in the room with the person who had it. CDC has now set close contact as 6 feet for less than 6 feet for 15 minutes. So we are going to that. We also are allowing people to come back to work with a doctor's order or a letter from DOH. We previously had required them to stay out 14 days regardless, and a lot of them are being allowed back to work at, I think it's 10 days or something like that.
If you are mild, right.
Okay. So, and DOH and or a doctor will give you a letter for that, I believe, correct? Yeah. Okay. So, Basically, we're following CDC protocol with that. So with that, we'll open it up to discussion.
I just, and so what you have on the screen right now and what was in our packet, that's the new, current, updated employee
Yes.
protocols? Okay.
It will go into effect after tonight.
The main thing is, the 14-day quarantine has not changed for anybody, but anyone who's tested positive, they release you from isolation after 10 days from when your symptoms started and 24 hours symptom-free, no fever, or your symptoms have improved and you're fever-free. So it just, there's some of us that would have gotten a letter cleared and gets us back to work sooner.
Right. There were several of them that I had to make stay out 14 days because that's what our policy said, where they were actually allowed back by a doctor or DOH sooner.
Okay, well, I've prepared a few things. I don't pretend to be an authority or to have a degree in any of these subjects, but I do feel like I've been taking a college level course over the last few weeks. So, but I appreciate the things that we're doing in terms of the employees. Obviously, it's not just employees that we're concerned about. So I just wanted to start. The mayor sent out an article to us that talked about, I think it was, it said new CDC study finds the majority of those infected with COVID-19 always wore masks. And so we went back and looked at what that study actually was based on, and it came from the CDC, their Morbidity and Mortality Weekly Report. And basically what that study that was quoted was talking about really was not about whether masks do or don't work. It was really about the fact that people who were dining out in restaurants or in bars were more likely to get the virus. I mean, if you look closely, what it actually says is that even though, and this is kind of a double speak, I think, but even though it said 71% of people who got COVID said they always wore a mask, but those people were in a higher, they were out doing other high-risk activities like eating and drinking at public places, which is probably why they were more likely to get the virus. But at the same time, 74% of the people who didn't get it wore masks always. So the CDC came out and said this article was kind of taken out of context and was misused in terms of what it was actually trying to say. The most recent Morbidity and Mortality Weekly Report, which came out on October 9th, talks about a study that was done in Arizona. And I'm just going to tell you what the findings were. Their summary says, what's already known about this topic is that community mitigation measures can help slow the spread of COVID-19. And what's added by this report is that the number of COVID-19 cases in Arizona stabilized and then decreased after sustained implementation and enforcement of statewide and locally enhanced mitigation measures. So they just go on to say what are the implications, and it's that widespread implementation and enforcement of sustained community mitigation measures, including mask wearing, can help prevent transmission of the COVID virus. And I actually did just forward to you guys these two studies just so that you would have them to look at. I also was looking at the letter that went out from the Municipal League that was signed by a lot of the mayors, including our own, and obviously in that letter that was sent out, it said, consider asking your employees and customers to wear masks, promote physical distancing within your organization, provide hand sanitizer, follow the CDC and prevention standards of cleaning, et cetera, et cetera. So I think, and wearing a mask when physical distancing can't be maintained was one of the things that it said that we should be doing. There was also, I bet I forgot to print it off, there's also a thing, I think that Sioux Falls has started this Mask Up. And I was watching the news one night when they were announcing it, and it was, you know, talking about where Mayor Tenhaken was saying, you know, we're asking people to wear a mask. And at the bottom of this, I took a picture actually of my TV screen because it was endorsed by both Avera and Sanford. So I think that, I know that we're in close contact with Avera, but I think that they would be the first to say that masking does help. So one of the things that I really appreciated last week, I know we all know that Lance Carson passed away, and I don't think there's anyone here that wouldn't like a couple of extra days with a man of his caliber. But one of the things that Tona Rosen said in the article in the newspaper I really appreciated. She said you shouldn't have to tell people to wear masks in public. If you're going to mandate it, you really have to fund the mandate. And then she went on to say some people just don't think past themselves and try to search things out to support whatever it is, their political views. So I think that there are several things that we kind of need to consider with this. I think the first thing is that I think that in Davidson County we're facing a public health crisis, in my opinion. All you have to do is look at the case studies and you'll see that Davidson County continues to report the highest number of active cases among the East River municipalities, as well as the highest number of new cases with the exception of Sioux Falls. So, I mean, I don't know if all of you have been watching those, but it's pretty impressive how much higher, how much greater the spread is in Davidson County as opposed to some of the other municipalities around us. Another thing that I want to remind everyone is that any mask requirement or request are not only to protect our employees, which we already are doing what we can to protect them, but we're also protecting the public. It's a two-way street. It's one of those things where the employees are opening themselves up to be exposed every time someone walks through the door and they don't know who the person that comes in has been in contact with. So masks are something that are going to protect others, not yourself. So if we're asking people to wear a mask when they walk into a city facility, it is not so that they're safe, it's so that the people, our own employees, are safe, and vice versa. So that if a person who works for the city is communicating with someone from the public, and then that mask that the person is wearing that is the employee is protecting them. So I just think that's an important thing. We often legislate things when it comes to public health and safety. I think we can all agree that when personal choices negatively affect other people, then that is when government tends to step in and make decisions. And I can give you some examples: seatbelts, texting and driving. We legislate, alcohol and even smoking indoors. So there's a lot of times when the government, it does say this is a time when there is a public health and safety crisis that we need to take a stance. And finally, I think that wearing a mask is an act of compassion, whether you believe the science or not. It is the recommendation of leading scientists and health experts. It costs nearly nothing, and it may save a life. Now, what we're requesting is a far cry. I was looking back at the things that we have had. We have the ordinance 2020-04, we had 2020-06.
06 was the one that we didn't enact.
Right. We've talked through several different ordinance options. Then we have the one that we have tonight that we're considering, 2020-13. And none of these are asking for a citywide mandate of, we're not shutting down anyone. We're not dictating. Remember the night that we sat here for 3 hours and we came up with this really great plan, and it included words like we strongly encourage masks and we We it requests that the businesses have no greater groups than 10 people, and we had all those, we worked hard that night, and for some reason, no one can find what it was that we put together that night. I don't know where it is.
That was '06 that had all that in it?
Yeah, but no, that was what we worked off of, but '06.
Yeah, '06 went away because it also incorporated the governor's
Right,
executive order.
But '06 was what we worked off of, but it wasn't what we came up with. It was more, it's actually more stringent than what we came up with as a council that night. I wish we could find it, because that was a really good document. I think that we put a lot of work into it, so it's too bad that kind of
Is Justin
evaporated.
still on?
I believe he's still on the call, but it was, since it was discussed during the meeting, it was not published with any of those revised changes.
Okay, all right.
Yeah, I know.
I thought maybe he would remember 'em.
I know.
Yeah, I'm still here.
What did you say?
He's still here.
Oh.
Do you remember any of that came up out of '06?
We made a number of changes at the meeting. Unfortunately, when we came back to that following meeting, the governor just rescinded her executive order, and we had to go a different direction, but.
Okay.
So I do think that the 2020-13 is really good, and I want to just say that I am a person who believes in liberty, and I believe that people have rights, and I'm I certainly am not a person who's a dictator at heart. So that certainly would not be my intention of trying to make people be mandated to do something that I certainly don't want to see anyone arrested because they walk into a city building without a mask on. But I do think that having that request and making that something that we request people do.
We currently strongly recommend them. I mean, isn't that the same as
But,
request?
well, I walked in and I drove by the doors of the Corn Palace and City Hall, and there's nothing that says that. We may say it, but we don't have anything in place that would say to people, we are requesting, and I think that you can say it in a powerful way and say, we respectfully request that you, for your protection and for the protection of our city employees, we respectfully request that you wear a mask. And I think that a mandate is, there was a whole other study that I chose to not bring tonight, but it talked about why mandates are effective. And one of the things that it does is it kind of levels the playing field, and it makes these darn things the norm. And so people, there's not anyone like looking down on someone else. You're wearing a mask, I'm not wearing a mask, you're good, I'm bad, or whatever. It just makes it so that, and for some reason, the enforceability of it, it was a whole article that talked about that, a study. But I'm not necessarily saying that that is the only way that we can address this. I think that if we, have that kind of verbiage, and I look at this, John and I talked a little bit today, and one of the things that we looked at this 2020-13, and John, did you want to tell about some of your suggestions that you had? Oh, I do. Okay, I'll keep going. Am I in a roll? Okay, so one of the things that John suggested was that we add a letter D under 3. So it says the requirement to wear a cloth face covering shall not apply to a person in a city-owned facility directly engaged, A, as an athlete, B, as a swimmer, when you're in your own office. And John suggested we add any employee in a shared space providing they may maintain the 6-foot distance. So if the group of people that work at the front office of City Hall, if they're able to maintain a distance of 6 feet, then they could, that would be a place where they could not be required to wear a mask. Another thing that I thought about, because I know that one of the things that you mentioned, Mayor, was that we had put up the plexiglass or the partitions right away. We have those in place in a lot of, you said everywhere.
I think they're everywhere, are they not?
A lot of people's offices that have
Well,
people that walk
okay,
in.
you know, offices that
Most
don't
of the,
generally have people come in them, we don't, but like the cashier out here.
most of the customer service walk-up windows.
Right, we have them out at the dump, I believe,
You have them at the park, rec.
Park and Rec has them, the
JVCC,
cemetery has them, the Corn Palace has
library.
them. So where we're generally dealing with public,
Yeah.
for payments and stuff, we have.
While that is good, I read a lot of these things by a lot of different people to find out their effectiveness, and it's better than nothing for sure. It doesn't necessarily allow for the, it's still, the virus can still aerosolize or whatever the word is, but it is certainly better than nothing, and I think that I could be okay with saying if there's a partition, you don't need to have a mask on. I know that one of the things that we talked about is that we have our new air purification systems, but I think it's important to understand how those air purification systems work. And one of the things that has to happen in order for those particles to be purified is that the air needs to be circulated through that purification system. And the example that I thought was best that explained it to me how that works, my son is a pathologist, and at Queen of Peace, he needed to do something in the morgue, and in order for him to do this procedure in the morgue, he had to give the room 15 minutes for that air to be purified. So it took 15 minutes for the air to be taken through that purification system before he could go in and do the procedure that he needed to do. So, so while that is a wonderful thing that we have here, and while it's a great to know that we have those air purifiers in place, if you're talking face-to-face with someone and they cough on you or they are carrying it and they, and they spit, you know how it is when you're like me and you talk with enthusiasm sometimes, who knows. If they sneeze, there's just a lot of cases where that air purification system is not going to have the chance to encapsulate that virus. So that would be another time when wearing a mask would be really the only solution to catching those kinds of things. So I guess my first desire, my ultimate desire would be, and not to be dictatorial once again, but would be to just be, as a community, set the example of showing that we believe that masks work, and that we would like people who come to the city buildings and who work at the city buildings, when they're talking, when they're engaged one with another. Even, I was thinking about people like Wade and Terry when they're out in the public and they're working with people, homeowners or whoever. I think those people need to be wearing masks when they're face-to-face with each other, or at least request it. And at the very least, I think our city employees should say, I'll wear a mask while we're having this conversation, and I'd appreciate it if you would too. And no, I don't think that we should arrest somebody if they choose not to, but I think that it would be a positive thing for us to be kind of setting that example that this is something that we believe can help. And once again, I can't reiterate enough that Davidson County we're on this upward trajectory, and I know that we talked that night. I think when we were doing the vote, I remember saying to you, Mayor, I said, so will you promise me that if we start surging, that we can go back to this? And I think that you said at that time that we
would look at it, and we will, and we are.
Yeah. So, and I don't know what it looks like to you, what that looks like for you when you say I'll do what I need to do when it gets to that point. I don't know what your threshold is, but for me, I think an ounce of prevention is worth a pound of cure, and if we can do something to prevent the spread I think that that is something we should take seriously. So I know that we've all received emails from people on both sides of it. I mean, there's no question that this is an extremely divisive and a very strongly opinionated issue. And I know that even just amongst us, there are, as well, there's probably just 2 opinions, but but there are 8 of us, and so anyway, so that's basically what I have to say. My first choice would be to have a mandate, but I don't want it to be a thing where we're arresting people, like I said. So I think that if that means that we do.
How would you see enforcing it? Not necessarily arresting people. The arrest that happened with the school was because of trespassing and whatnot. But
no,
you have to have some method.
No, and I don't know that we do. I think one of the comments that came up, and this was in a conversation that Jeff and I had, Jeff said, I wear a mask most of the time, except for when you forget, right?
Tonight.
I mean, he said, no, when I forget. He said, when I'm going into public buildings, I almost always wear a mask, except for when I forget. And I'm the same way. I'm telling you, twice today, I went into places and I was like, oh, I forgot my mask, and I ran back out and got it. So it's human nature to forget.
This is the first time you wore a mask at a city council meeting, though.
I know, and you know what? You know why? Because I've been watching the numbers. So I think it's time. What?
They've been jumping, they didn't just start today.
Well, I
think
have.
the CDC has a good guideline. People follow it.
I know.
I
I'm
was at
telling you
gas
what the
station
guideline
tonight,
is.
And the lady says, make some good decisions tonight. I said, what's that? She goes, no mask. Some guy pulled his mask down and said, yes, no mask. I mean, there was like 5 people that all.
Okay. Well,
I think the general public are smart enough to make their own decisions and do what they think is right.
and I think that if we
make the city, everybody wear them, you go to the swimming pool, can you swim with the mask on?
That's
You
one
play
of the
hockey with the mask
exclusions.
on?
That's one
Well,
of
you
the
can't
exclusions, Kevin.
You can't exclude things. You gotta either,
What do you mean? Did you read this?
yeah, I read it.
Well,
if you're gonna
one of the
mandate it for the
exclusions
city-
was as a swimmer.
If you're gonna mandate it for the city, you can't say these people can and these people can't. You gotta have it
This
for
is
everybody.
this is the ordinance that we're looking at, Kevin, and that's 3D
I
as
think
a
people are smart
swimmer.
enough to make their own choices. That's what I'm saying.
Can we open it up?
Absolutely.
Come on up. If you want to talk to this, come on up. State your name, please.
Mayor, are you having me time?
Yeah, we ask you to try to be at 5 minutes, so she'll put a timer up there so you can see it. So.
Good evening. I'm Dwight Stadler. I live at 700 West 7th Avenue. And Counselor Jarts, you know I have the greatest respect for you.
I know.
However, I disagree with you. And what I want to do is provide some objective evidence. Before I do that, give you a little bit of background about myself. I served 30 years in the Veterans Health Care Administration. My last 14 years in the Veterans Health Care Administration, I was neck deep in infection control and infection prevention. We dealt with everything from hazardous waste to Ebola. And one of the things in my last 2 years in particular, I was responsible for conducting fit testing for doctors, nurses, and interns, and training them on N95 masks. And so that said, one of the things is that COVID's being used as a political tool by politicians and the media fear-mongering for political gain and attempts to influence voters for this election. I don't think I imagine there's a lot of people that would agree with me. But here's the thing. COVID-19 is a virus. And the CDC recognizes that COVID-19 is an airborne pathogen. In fact, viruses in general are recognized as airborne pathogens. And they're microscopic in size, about 0.1 micron, which is 1/1,000,000th of a meter. Airborne pathogens are different than droplets. Droplets go short distance. That's where you get into your social distancing, and they drop. Airborne pathogens remain in the air for several minutes up to hours. In order to protect against those, you have to have an N95 mask, which provides an effective seal. Facial hair won't seal it, okay? These masks do nothing for airborne pathogens. They're going to get in around the edges. So if you're exposed to airborne pathogens, as COVID-19 is a virus, and it's airborne, and it's recognized by the CDC as airborne, what those masks really protect is they're intended for the person who's infected as they cough or sneeze or whatever, and because they're spreading airborne and droplets during the course of that. Just lost my train of thought. So to stop those airborne particulates, I think we're kidding ourselves if we're going to go with mandating any mask usage, because you're not going to stop those airborne particles, those microscopic particles from getting in. I'm not opposed to voluntary wearing it. I think it's more psychological than it is physically beneficial. I recognize that the CDC sees it this way in recommending masks, and that's fine. But coercing people to wear them, I don't believe is an option. I'll tell you what I think is the number one contributor to infections are these little jewels here. Because people pick their nose, scratch their armpits, their butts, their genitals, cough and sneeze in them, and then they come over and they say, hey, how you doing? And they want to shake hands with you. They touch things. Guess what? I just touched everything. It's infected. You're better off educating and training people on how to disinfect, how to cough into their elbows, use handkerchiefs, sneeze, whatever. You're better off with training and educating people about the spread, personal hygiene, sanitizing, even your computer keyboards that you use individually. You go out of this room, you don't know who touched it. Even you, if you haven't washed your hands the last time you used that computer keyboard, guess what? There's germs there. So bottom line is, I think you need to look also at Sweden. Sweden didn't do social distancing, they didn't wear masks, and they didn't do lockdowns. And their numbers are astronomically lower than what's in the United States for COVID infections. By the way, what's not being reported in the news are recovery rates, and the mortality rate is low as a percentage in the whole thing. You're not getting anything about recovery rates. And typically, about 95% of the people recover from COVID. I shortened it much shorter than I planned, but thank you.
Thank you. Anybody else?
I'm not going to get into this. I'm from Friends of the Fire Steel, and I just want to say thank you. Good evening. We really appreciate it. Thank you again.
Thanks, Mike.
Hi, I'm Sonia Vanderwick. Most of you probably know who I am. I'm going to talk a little bit about science stuff and maybe things that you haven't heard yet because it's not really been out there unless you've got the right channels. There actually is no randomized controlled trials verifying the outcomes to show the benefits of healthcare workers or community members for wearing mask or respirator. There's no such definitive study. However, there is a study that was done in 2015 that showed in the hospital setting with mandating they were having cloth masks, surgical masks, or no masks. And what they found is when the healthcare workers who know how to take their mask off and put it on, when they found that the cloth mask actually increased the infection rate of 13 times. These are healthcare workers that know how to use it. I used to work in the ICU. I've worked with isolated patients. I had to be fit tested for also an N95, and even an N95 is not going to totally protect you from the virus. The type of mask that they're selling out there, even the one like that Susan is wearing and other people wear, the particles go all out. They're so small, they go through the sides, they go through the front, they go everywhere. And in fact, when you touch it multiple times, you're infecting it, you're actually causing more transfer of different viruses and bacteria when you're touching the mask frequently and then touching other surfaces. And so that's where you get the increase of infections. In addition, they are seeing increase, this is a weird one, dental caries are being found throughout the nation because of the mask wearing. You've got bacteria and viruses that are normally expelled because that's how God made our bodies, right? We have all these digestive system, everything where we get rid of bad things in our body. So when we obstruct that, then we can't exhale the bad particles. So what happens?
they get into this fomite area, into your mask where it's very moist, you're wearing it for an extended period of time, you can get an increased risk of flu, bacterial infections, pneumonia. We can get staph infections. People have had local skin infections, acne, all that kind of thing. You can get headaches. So I think it would be extremely actually against the health of the population to do this. And in addition, there is a liability issue you need to see. Wearing a mask is a medical intervention. So then you are taking liability on yourself. You are taking on a physician's role who should know each person separately and their health problems. So if you all of a sudden say to your city employees, well, you all have to wear masks now, well, what happens to the person that you're not watching them and their CO2 is going up because you're obstructing the exhaling of CO2? And what if their oxygenation sats go down because their oxygenation levels have gone down? So there's issues with that. And then you've got also the masks that they're wearing. Okay, are they washing the cloth masks? We see it in the school. Okay, how many of these kids are washing their masks? Because I know some people, they send their kids, I only know a couple people, they send their kids with 3 masks a day. Who's doing that? Who's washing these masks? I mean, you see them on the floor, you see them on the rear view mirror, you see them in the backpacks, you see them in your, if this was such a bad virus, we would be throwing all these masks in a hazmat, in a biohazard, and that's just how it would be. I'm just saying, I've dealt with serious viruses. The other thing we need to look at, and I don't know if any of you have heard of this, is the testing itself. I've spent a lot of time looking at the PCR testing. This PCR testing was given emergency authorization by the FDA, not approval, authorization. And why? Because this PCR testing picks up on viral fragments, dead or alive. When they use this machine, such as used at Avera, one of their machines, I've got the document for it, they use 45 cycles. What they do is these cycles, they increase the number of cycles you go through to amplify the genetic material. So when they amplify that, it can amplify any type of genetic fragments. It could be a virus of any kind. It could be a coronavirus. We have viruses in our body all the time. So when we do the testing specifically, it is not necessarily picking on COVID-19. It could be coronaviruses, okay? Even in the CDC document on their PCR testing, I'll read you specifically what it says if I have enough time here. Let's see if I can find it. Okay, detection of viral RNA may not indicate the presence of infectious virus or the COVID-19 is the causative agent for clinical symptoms. This test cannot rule out diseases caused by other bacterial or viral pathogens. If I can find the other one. In addition, since no quantified virus isolates of the 2019 COVID are currently available, assays designed for detection of the coronavirus were tested with characterized stock. So what they're saying is there's no quantified number. So when they do this testing, it's not like it's going through and saying, well, this is COVID-19, because it's just genetic fragments of it. It's not the whole genetic sequence. So this is a serious question. And I'm not the only one that's bringing it up. You can look at the Great Barrington. Well, there's other stuff I can send you if you want to know about it. But anyway, that's what I had to say.
Thank you.
I could talk for another 20 minutes. But.
I just want to respond. We're just recommending that the masking while people are working directly with the public. I mean, I feel like the changes that we've put in here, if we say, if we take out people that are working behind a glass partition, if we say that people don't have to wear it if they're in a shared space and can maintain their social distance, people in their own office, it's not like we're saying that people have to wear this around the clock. I feel like we're just asking them to do it when they're dealing with the public directly. Whether or not the tests are, testing living or dead pieces of the virus, I think that all of us in this room know people who have had the virus who have been very, very ill. And there's probably not any of us who can't think of someone who has been affected directly or indirectly by that. I don't know, I guess if there are people in this room that haven't, then you're lucky. But so whether or not, all I'm saying is that whether or not 100% of the tests are whatever it is, the bottom line is there are people that get this virus that get very, very sick. And I think that those people would say darn it, I wish someone had worn a mask, or I wish there would have been a way for me to potentially be protected from this. And this is just one little thing. It's not a big deal. It's not like we're saying everywhere in Mitchell, we're not closing businesses, we're not telling people that you have to do it. My recommendation would be that we have signs on every public building that say, we respectfully request that for your protection and the protection of our employees, that you wear a mask while in this public facility.
Is there anybody else who wishes to talk to this? Sure. If nobody else wants to talk, you can come up for.
Mayor, Mr. Mayor, just one. Can I give Sonia my 5 minutes? Can I just?
Let Mr. Rice go.
I just got one question. It's an internal question. And Susan, you keep referring to our ordinance 2020-13, but that's not a public document. That wasn't part of.
No, it was
So,
what, it was what we
people
were
that are,
given tonight.
people that are coming here and talking
Oh.
haven't seen that document.
Sure, that's a good
Right,
point.
it's a draft of.
They haven't seen that. That's only
So
been
that,
shared.
that wasn't something that was included in our packet?
No.
No.
So
That's
they
just a
wouldn't
draft, Mr.
know what is contained in there or what's on there or anything. That's why this is just a discussion.
Right.
And therefore, I mean, there can't be any just presentation of anything or vote.
Right, state your name
Absolutely.
again so people on.
Sonia Vanderwyk. I'm not saying that the virus doesn't exist. We know it exists. Actually, I have a paper from 2008 that shows that COVID 1, 2, and 3 was available back then. So if you want that paper. I'm not quite sure what that's all about. But anyway, so with the PCR testing, though, yeah, we know the virus is out there. The problem is we know from experts and even the person that developed it that it wasn't meant for diagnostic. Hence, that's why the FDA approved it for emergency authorization. However, what I'm concerned about, and I haven't heard a lot of this, but I've heard it from people in it's called the Great Barrington, the Great Barrington Declaration is called.
It's not from Mr. Barrington, is it?
It's called the Great Barrington Declaration, and it's actually over 26,000 medical professionals, over 10,000 medical and public health scientists, and over 500,000 citizens throughout the world. And this is like people from Harvard all over, okay? And what they're saying is that we need to go back to normal except for people who are at risk, okay? And these are scientists from all over the world. There's also the German coronavirus task force that started meeting in July, and they talked about the PCR testing. And these are individuals that are very smart. And they're saying, this PCR testing wasn't supposed to be used for this. And so why are we seeing all these people that are asymptomatic? Well, it's because when you're doing this testing, it can actually pick up on dead viral fragments. Okay, this isn't something I'm making up. This is from what I've heard, and I've listened to professionals, microbiologists, immunologists, who say that it can pick up on any old viral fragment. We have viruses in our body all the time. So if we have just breaking down, because our immune system is so good, because God created it that way, it breaks down these viral fragments. That's how our body does a response to it so it doesn't become overgrowth, right, and replicate. And so those little fragments can be in our body. That's why you have people that are testing positive that are asymptomatic. So they're being treated like a leper. I mean, seriously, people, we are going nuts on this. Okay, we are treating people like they are so contagious. I haven't worn a mask the whole time. Have I been sick? No. Do I get sick? No. Why? Because I'm doing stuff to boost my immune system. So we have to look at what is going to be our response to our community. Are we going to teach people how to boost their immune system? Are we going to look in and ask the questions? Because I want these answered. Like, if the testing is, why are we doing all this testing, and if it's picking up on viral fragments that we normally have in our body, this needs to be seriously looked into. Because there's already major scientists throughout the world that are asking these questions and are calling for this to end. I'm just saying to you guys, it's very disturbing to me. I want answers. I'm sure your son, he might know about the PCR testing, but from the CDC manual it says those certain things. It's disturbing to think that they don't have a quantitative virus out there for this. Now, I'm not saying it's not here, but why are we doing all these testing if it's only picking up on viral fragments? That could be from anything. It could be from a cold. And it specifically says in here for the one Avera test that they do, that's a quick one at the hospital, that they do 45 cycles. Well, from the microbiologists and people, they say if you do 30 to 32 tests, then if you have something that shows up and you look at their symptomatology, then you might have an infection. However, when you go to 45 cycles, you are cycling it so many times to amplify that genetic material so it shows up. You see what I'm saying? So that's why I'd call this, not me, I didn't coin this, this word, but case-demic. So we're at a point where across the nation, the deaths and hospitalizations are down. Why are our numbers up here? I really seriously think there's more than just this COVID going on right now. There's other infections, other viral things, other pneumonias that maybe aren't being treated appropriately because we're coining them as all COVIDs. So what are we doing? I mean, some people in this room are probably thinking I'm nuts, but I'm not, because I'm not the one that's creating this. This is scientific people. And if you want all the documents, I can send them to you. I've already got it in emails out to people. So any questions? I don't know. I don't know what else I can say, but that's it.
Thank you. Come on up. State your name again.
Dwight Stadler, 700 West 7th Avenue, and I'm certainly not going to be as eloquent as Sonia is. I missed one particular point on the mass, and you probably will agree. And the entry of these viruses come through your mucous membranes, and of course, most commonly it's the mouth and the nose, correct? But what does the mask not cover? Your eyes. Your eyes. So it's entering through your eyes as well. When you get into droplets precautions, if somebody's close enough to you to cough and you get the droplets, the mask isn't going to do anything for your eyes. And if you're fortunate, you got glasses on. Maybe that barrier that you're talking about. But I again go back to, I'm perfectly fine with voluntary wearing. Leave that to the discretion of the person. But I think Sonia's done a very eloquent job of explaining from a more scientific perspective than what I've done. I can tell you my experience with it being a microscopic particle and it getting around, and as Sonia pointed out, it goes even through the cloth material. So you're really dealing with an ineffective methodology. I'm still a firm believer in that these jewels, hand washing is and I think they'll even teach that in the medical institutions. I know we did. It's the #1 cause for infection transmission. If you're not washing these hands, hand sanitizing, this is the #1 cause. Guarantee it.
Thank you.
Thank you.
Anybody else? Okay. Council, anything else? Okay, this was discussion only.
Yeah,
Go ahead.
so what's the next step? How does this proceed? Does 2013 in some form
That is, I guess, up to
be
you.
put on the agenda for 2 weeks from now? I mean, I don't know, I didn't understand where this was going, but.
Well, we had the discussion and we have a draft of an ordinance, possible ordinance. So I guess I need to hear from you guys whether you want to do it, think about it for a few days and get back to me individually. Again, do not copy all on an email because that constitutes a meeting. So if you want to do that and let me know your feelings individually or however you, I guess it's up to you guys. But if you want it to continue on towards an ordinance, then we have a draft and we would have to put that on for first reading next time, second reading the time after that, and adoption the time.
And Mayor, I'm sorry to jump in here. Hopefully you can still hear me. The one thing that I would add there, I know there was some discussion tonight about not wanting to arrest or what the consequences would be, but if you're not going to have those types of consequences and enforcement methods, there's really no purpose in putting that stuff into the ordinance if it's just going to be that strongly suppressed. So keep that in mind if there's going to be a push to bring back another ordinance. That's something to keep in mind.
I know we do have signs around, and we can add signs. I mean, that's no problem.
I have some pictures. I can tell you, though, that all of our signs focus on social distancing. None of them refer to masks.
Masks, okay.
The only one that does would be in the library. they do ask for people there.
I think in the
that are
door of the
entering.
JVCC,
Nope.
doesn't it say mask?
Well, JVC Jessica
think-
was gone, I didn't get her.
I think they have a strongly recommend mask because they go
But
there
you
every
can
Monday.
see, these are some samples of some of the signage that's out, and everything that I saw or got copies of is just asking for social distancing and asking you to monitor your symptoms. We do have stations, this one's set up on the bottom right there, for people, employees that are coming in for temperature checks, that kind of stuff. But those two in the middle are from City Hall. The one on the left is at the Corn Palace. The one on the right is at the library. So none of our signage currently does request anyone to wear masks. We do, we did order some, and we provided those to all the departments so that they can make them available for anyone coming in who might want one. But our signage does not request it now.
I think the sign that says strong, highly recommended or strongly recommended to wear a mask, but there's no way we can mandate a mask.
So we
My
could,
opinion.
we could do like a more standard signage that would include the social distancing, the mask, and the CDC requirements, and the updated symptom list, because as you know, it went from this to this. So we
So-
could update those items.
The wording we put in at the library, and we had suggested masks be worn, and we changed it to, we expect masks to be worn while you're in the library, but also remember, the library, we're dealing with items that are touched and other things, and we're also limiting the time you can spend in the library. But that, to say masks are expected, but there's no consequence, there's no enforcement, there's no anything from that standpoint.
You have signage?
Yeah.
We got signage out there that's mask mandatory, sitting right in the middle of where you walk in, and 25% of the people.
At Ramada?
25% of the people have masks on.
At
We have signs when you go into the Holodome and the Convention Center, enter at your own risk, that mask recommended, not required. And 2% wear them.
Well,
at the most.
the other issue is the wearing of them correctly, because, Menards requires them, and most of them are down here. Some are down here, some are under here. They have them.
You don't see the grocery stores putting, mandatory masks on, nobody go to them. They lose business.
Okay, well, as I said, this was discussion only, so if you want to let me know, take a couple days, think about what was said here and where you want to go with it.
And Mayor, maybe this is a good opportunity to maybe reiterate that we have purchased the purification system that Susan had brought up. I'm curious to know how long does it take to completely circulate? And then the other thing,
It's really, that becomes a factor of how much air you're sending out of the system. You'd have to do some calculations on it, which I can do.
right, and it's not full,
And,
foolproof. We know.
right,
that.
when
We
you,
are-
when you walk in a building, you're breathing out. Theoretically, you've got particles and this and that and everything else coming out of you when you exhale. So, yes, it wouldn't instantly catch that. It would have to go through a cycle. But
Yeah.
typically, there's probably an air change every roughly 10 to 15 minutes in a building. Just kind of.
The other thing is, we actually, I know, Mayor, you're in constant contact with medical.
We have
especially
meetings with Queen of
you have-
Peace and
Are they
the county.
typically
Well, we've gone to every month now.
every month now? But if it escalates, you probably would go to weekly, or if there's some concerns out there. And then you're also in constant contact with the governor's office.
The other mayors, the first-class mayors, so, and that's gone to monthly too,
Right.
as well, so.
Okay,
yes.
but the point is you're monitoring it.
Yes,
You're
and-
on top of it. Yes, our numbers are going up, but I've got full confidence that you will be able to lead us to whatever direction we need to go.
And the editorial letter that went out was a show of unity between the first-class mayors, the largest city mayors. Nothing was made mandatory in that letter to the editor. It was all a voluntary thing, which is why most mayors got on board with it, so. Okay, anything else? Anybody in the audience want to say anything else? We're adjourned.